Have you ever had a pain, let's say a headache, and it was bad enough in the morning that you thought about not going into work or not going into school, but then you went anyway. And a couple hours later you thought back and thought, where did that headache go? It was gone. You had been distracted from it. Or maybe you've had this experience. You have a pain in your belly or in your flank. And at first it's not too bad, but it's lasted for long enough that you start thinking, well, isn't this how my brother's kidney stone pain started? And didn't he describe that as the worst pain he's ever experienced? Now the pain seems a bit more prominent and it's bothering you more. Or what if it's not your brother or a kidney stone? What if it's your uncle you're thinking about? And your uncle was recently diagnosed with renal cancer, cancer of his kidney. Wouldn't that make you suffer more? And now aren't you a bit more worried about this pain in your flank? Well, one way to understand those experiences is to think about pain as part of your total suffering. And we're going to use a model that was put together by Roger Woodruff in this book. Woodruff divided pain into 6 categories, but only 2 of those categories were visible. Those would be the physiological pain that we're familiar with and the physical symptoms associated with that pain. Everything else, the spiritual, the cultural, the social, and the psychological factors that influence our total suffering are all below the surface, kind of like this giant iceberg hiding below the level of the sea. I think this concept is best understood with an example. For instance, I saw a patient the other day with my resident. She was complaining of a worsening of her knee and her back pain. Now, she had had this knee and back pain for a long time. In fact, we'd already diagnosed her with osteoarthritis. So my resident saw her and asked her the usual questions. The patient said she was having trouble sleeping and the pain medications weren't working as well as they used to. Then my resident asked to examine the patient, but the patient refused. When my resident, surprised, said, "Why don't you want me to have a look at your knee?" the patient started to cry. Turns out her daughter and her son-in-law had just recently asked her to move out of their house. How was she feeling? Abandoned? Betrayed? Lost? There were psychological stresses, to be sure, but there were also social stresses. She had also gone looking for housing, and she had been told that the waiting list was over 2 years long. So let's add up this patient's total suffering. Well, we know we have the long-term osteoarthritis of her knee and her back, and then we have sleeplessness that's probably making that pain worse. Those are the visible signs of her suffering. The invisible signs that took a little longer to come out are the psychological stress associated with being abandoned or betrayed by her daughter when she asked her to move out. And then there's the social stress, knowing that she's going to have to look for new housing now. And I bet if it wasn't for those 2 other stresses, she wouldn't be in to see us for worsening pain of her knee and her back. Well, the good news in this story is that just like those hidden forms of suffering can magnify and amplify a patient's experience of pain, well, managing those hidden forms of suffering can actually help decrease the patient's physiological experience of pain. So in this case, for instance, we didn't go after managing her osteoarthritis pain any differently, but we did talk about managing her sleeplessness, and we did talk about how we were going to manage her new housing crisis, and about how she was going to manage those feelings of being betrayed by her daughter. And we think that in managing those hidden forms of suffering, we were really going to help her manage her overall experience of pain. So in summary, in Woodruff's model of total suffering, we'll have 2 more visible signs of suffering, and that will be the physiological experience of pain and the physical symptoms that are associated with that experience of pain, like sleeplessness or like other discomforts which are directly associated with the pain. Then there are the 4 more hidden types of total suffering, like the spiritual area, for instance. Some patients will feel that pain is a sign that they've been abandoned by their faith, or perhaps a sign of punishment. A cultural form of suffering would be, for instance, if you come from a culture that sees your pain as a kind of infirmity or weakness. There are lots of ways that you can suffer socially when you have pain, and most of those come from the fact that you can't participate in the social things that you did before you had pain. Psychological stress is another big area of hidden total suffering. Everything from worrying about what the diagnosis might be, to worrying about how you're going to get back to your activities, to being depressed about not being able to contribute to your family. But remember, each of these areas of total suffering are areas where you can have a positive impact. If you can help a patient manage their psychological stress, or their spiritual or cultural or social stress, or their physical symptoms that are associated with their experience of pain, then all of those things can come together and help manage their overall experience of pain and ultimately decrease their total suffering.